Hi, my name is Jed Delmore, and I'm a GYN oncologist based at Overland Park Regional Medical Center and the Sarah Cannon Cancer Center. Today, we're going to talk about human papillomavirus vaccines and some of the myths and truths related to the vaccine. As a GYN oncologist, I treat women with cancer of the reproductive organs. That's cancer of the cervix, uterus, ovary, and vulva. And some of those cancers are attributed to human papillomavirus or HPV infection. Hopefully with the vaccine, we can see a continued reduction in those numbers. What I'd like to do is start with some of the facts about HPV and then go into some of the myths related to the vaccine. There are over 200 types of human papillomavirus, and of those, about 20 are associated with an increased risk for developing precancerous conditions or cancers, which could involve the throat, mouth, head, neck, and genital organs. About 13 million cases of HPV are diagnosed each year in the United States. About 36,000 cases of cancer related to HPV occur each year in the United States, but probably as important to women who've been evaluated for abnormal pap smears. About 200,000 women each year are diagnosed and treated with precancerous conditions because of abnormal pap smears, all of those primarily associated with human papillomavirus. So with the vaccine, we think that almost 90% of those precancerous conditions and cancers can be prevented. So that's the facts pertaining to human papillomavirus. The vaccine has been around for almost 12 years. And as is true of many vaccines, there are some concerns raised early on and myths, things that are not really true regarding the vaccine. One of the things that may have been perpetuated early on is that the human papillomavirus only affects women, but in fact, almost 85% of all men and women will be found to have a human papillomavirus infection at some point in their lives. So it is a very common infection. Unfortunately, most of those will spontaneously resolve. Some will go on to progress to become precancerous conditions. The vaccine was originally recommended or approved for treating young women, and now for boys and girls, only because the men have an equal opportunity of getting and transmitting human papillomavirus and developing cancers. Secondly, there is concern that any vaccine, and specifically the HPV vaccine, could cause a problem. In the past, vaccines were made with actual virus or parts of a virus to stimulate the immune system. There's no HPV DNA in this vaccine. This is made to mimic what would be the shell or the outer envelope of a virus. There's no DNA and there's no genetic material present in there. As is true for any vaccine, if you get an injection, there can be tenderness and there can be irritation at the site, but we have no evidence that getting the vaccine results in a significant health condition for anybody who has received the vaccine. Almost 250 million doses have been given worldwide and about 120 million doses in the United States. All those side effects, if they were to exist, are monitored closely by the CDC. Another myth is that the vaccine could potentially affect fertility, either the ability to get pregnant or carry a pregnancy. And we have no data or evidence to suggest that taking the vaccine would impact fertility at all. In fact, it may improve some of the ability to carry a pregnancy, because if someone has an HPV infection and develops a precancerous condition, then part of the cervix has to be removed or treated, and that may make it difficult to keep a pregnancy for full term. So by reducing the effects of the HPV virus on developing precancerous conditions, it may actually improve fertility rather than impact that. Another myth is that if you just wait and you get the HPV infection, that you can treat it. And we don't really have a treatment for the virus. We can treat the effects of the virus, that is the precancerous conditions or condyloma or warts, but we can't actually treat the virus. There's no antibiotic from that standpoint. So the benefit is to use the vaccine to prevent a problem rather than wait to treat the effects from that. And finally, there's concern that the vaccine, or at least a myth that the vaccine could contain ingredients which would be harmful. And like many of the vaccines produced that your kids already get, these are manufactured under the supervision of the FDA. The contents of the virus have been extensively studied. There are some components that are naturally occurring, such as aluminum. None of those are of a risk to anybody. So we have no evidence that there's harm related to the ingredients of the vaccine. So in summary, there is significantly more benefit to consider having your children immunized, and this should be considered no different than any of the other vaccines that your kids get when they are little, when they go to school, and the long-term benefits have been clearly demonstrated. I hope that helps clarify some of the questions regarding the myths related to HPV infection and encourage you to have your children immunized. Thanks very much.